Hi lovelies, oh gosh, I've just done a massage, I forgot. This is for a really nice gentle Pilates session. I just had a back class cancelled, so I figured I'm away for the next few Fridays. Not tomorrow, I'm doing tomorrow, but next few Fridays with holiday. And I just thought for my lovely Friday morning class and anyone else who wants a relaxation, this is for you. And also for my beautiful sister-in-law as well. So lots of nice shoulder mobilization, lots of nice backs. So without further ado, let's just start with some lovely shoulder shrugs. So just take them up and down. And again, up and down. And again, up and down. And how awful does that feel when the shoulders are up near your ears? So keep them down. And then just circle. If you can't do this one, so if you just sort of post breast cancer, you might want to do this, or just post shoulder surgery, and that full flexion is too much. Just take it and for 4, and then the other side. I should say, if you are post breast cancer surgery, obviously you need doctor's permission, sort of 8 weeks, really 6 to 8 weeks. You should have been given a leaflet anyway, and then both together. But really important that you start trying to move your shoulders, get some mobilization. So we won't do strength work today. You need to have got your full range of motion back before you start doing some strength work. 2 and 1. Well done. And then we're just going to take our hands and take them behind our head. So interlink your fingers, thumbs into the nape of the neck, and just bring your arms in and then away. So we want to try and stretch the pectoral wall. So this is good for anyone, not just someone who's had surgery. Obviously for breast cancer, you obviously have some scarring, some fluid maybe build up in the chest. So you just want to use that lymphatic system to just any kind of pumping action. But for anyone who's been sat at a computer as well. And 2 and 1. Well done. And then we are going to take one arm out and just protract and retract it. Try and keep your arms straight. So protract and retract. So just notice what happens when you're doing this. So as you protract, you shorten the front, so work the pec muscles and lengthen the back, and the opposite when you retract. And again, 4, 3, you can move your arm different directions, so a little bit out to the side. Keep everything flowing. And down, and again, protract, retract. And just notice, does one feel tighter than the other? I should probably have said, try always with the unaffected side first. Obviously, if you've had a double mastectomy, that's different. And just protract, retract, so it feels stiff. And 2 and 1. And then let's try all those shoulder movements. So the shoulder's like the hip, it's a ball and socket, it can do an awful lot. So just see if you can. Sometimes getting it to about 80 is a little bit uncomfortable, and then between 80 and 120. So just take it up, palm up. Can it go over? Don't worry if it can't, just go to where you feel comfortable. And again, good. Just had a lovely girl, only young, who's come from massage as an accountant, and all the knots in the shoulder. And I think with COVID, everybody is feeling a lot of stress. I don't think we'll probably know how much stress until years gone, years later. The other side, and then up. But yeah, we're all sat at computers, not well I'm not, but most people are sat at computers more, talking on their phone more. And as a result, the upper traps the muscles that insert into the scapula, the rotator cuff muscles, can get super lengthened, super tight, and the pec muscles get short. And 2 and 1. Well done. And then take it to here and just draw the belly into that navel towards the spine and just pull back and forward. Pull back, so working the upper trapezius muscles in the back, and just feeling that stretch. Be careful not to do this, yeah? So we're not doing that, we're not moving the back's keeping very still, just back and forward, back and forward. And 3, this is lovely for me as well after being hunched over a bed, and 2 I love massaging, but yeah, you can get quite tight. And then gently down, and then just do a little bit of neck work. So try and keep, remember we don't want that to happen, so slide the scapula down, and then we're just going to take, actually my lovely Ruth, hi Ruth, I'm going to send you this, darling, because I know you're always tight through the neck and the traps. So we would never ever take the time out to do these kind of exercises, would we? Unless you're in a class situation or a video, doing a video. So again, just notice, often we stretch without mobilising, so we're just going lateral, and then we're going to go forward, so chin. Again, I should have said, if you are just a little bit fatigued, so if you're still going through any treatment for anybody who's having breast cancer, surgery or treatment, you can do this seated, obviously. Should have said that at the beginning, shouldn't I? Sorry. It's good to stand though if we can as well. And 2 and 1. Well done. This one's a good one as well for my best friend Jo, who's always tight. And forward and back. Less so, because she's been treating herself to massages, which she rightly deserves. And again, protract, retract, protract, retract. So you'll see some people like that. Yeah, so they want to retract more. Yeah, retract. Almost like you're giving yourself a double chin. Bring it in. One more. Good. And this next one I find easier sometimes on the floor. But anyway, we'll give it a go. So chin to chest. And then just gently take that chin towards the shoulder. And then the other way. So my neck's always a little bit tight. Partially deaf in my left ear, and the vestibular system responsible for a lot of the neck movement, so that can be an issue. And I do a lot of plank and a lot of massage, so some of it's kind of work-wise, some of it's just years of overcompensating for my hearing. And gently back to centre, and then just the rotation. So again, shoulders down, tight through the tummy, rotate. Try not to flex. I tell this story where I went on a pain management course with a beautiful company called Z Health in Copenhagen. That was powerful. And he got me out to front, Dr. Eric Cobb, a wonderful man. And he knew straight away I had hearing issues, because when I rotated, I automatically want to flex. So try and keep that chin parallel. One more. Actually, another one. So only when you've mobilised in your directions, yes, so lateral, forward, back, protract, retract, and rotation. And if you're much better than me, I'm not very good at this, you can put your finger into the neck and try and push it along. So you're stretching here, so like a lateral. So you'll see all these wonderful dancers do this. I always think of Madonna in Vogue. Can you feel that? So you're pushing. So we've got a lot of deep muscles, sternocleidomastoid and the levator scap. 2 and 1. And then and if you're really tired, looking for a massage, I love doing necks. Okay then, so once you've kind of done that, then you can do a nice stretch. So you can take the hand on the head, it should feel a little bit easier. And then you can go into your stretch, send the middle finger down towards the floor. And then you can do some little circles. Circle 2, circle 3, circle 4, and 5. And then just gently back. And then switch, and again just down. Again, notice, so you want to keep this big gap as if you can, so really reach the finger down. And again, you can either just hold. Some people who don't suffer too much with the necks can take a little gaze down to the floor. Sometimes that's a bit much for me. And then circle. So I talk all the time about stretches should feel mild discomfort. Sometimes we overstretch. Never a good thing. We don't want to send pain to the nervous system. 2 and 1. Well done. Because you've been stood a while, you may want to just do some little pelvic circles to soften the knee. And for those of you that are quite new to Pilates, you might wonder what all this pelvic circling is about. 1, it should feel very nice on the lower back. And 2, it'll give you an idea of where the pelvis should be. So think about the pelvis as being a clock face. So back again. So the hips 3 to 9 on the clock. Yeah, look behind me. 3 to 9. Pubic bone and hip bone 12 and 6. Yeah. And we don't want, when we're doing abdominal work, we don't want to be tilting, we don't want to be pushing under, we certainly don't want to be doing that. So I'll explain that a little bit when we get on the floor, because we're going to do a little bit of movement on the floor. But before we do, I want you just to come into, so again, if you're quite new to Pilates, if you've been going through any kind of breast cancer treatment, obviously it depends on what treatment you've had. If it's chemo, it can sometimes affect the nerve endings, peripheral neuropathy. Radiotherapy can sometimes, you're at risk of lymphedema if you've had an axillary clearance. So just, always get medical advice first. If you have got lymphedema, you should always have a sleeve on anyway. But also affects sometimes the joints, things like anastrozole, tamoxifen. So we just want to keep the joints moving. So you're just kind of doing that circling action. Look at me, not down at your knee. That sounds really vain, don't it? Look at me, you know what I mean. And 1, and then the other way. Circle for 6, for 5, for 4. So if you're a lot of my clients, if you're watching this, it's a nice gentle session. Yeah, if you do lots of strength work, lots of cardio work, you need to give yourself some time to do something lovely for the body. My favourite kind of session. And then just circle. Again, you might not get your arms all the way up if you've had surgery, so just take your time. And for 3, for 2, and give yourself a bit of, love. Yeah, so even things like this, which seem quite gentle, if you've not done anything for 2 months, it can feel quite intense. Yeah, remember just not so long ago, last week before, listening to Julia Bradbury, who's obviously very fit. Hold, and then gently up. And she was saying, just after a mastectomy, just climbing up the wall, which is a really good one to do, just felt virtually impossible in the beginning. So just give yourself a bit of self-love. And again, and 2, feels good, 3, 4. Yeah, no one have a class at this time, but lots of people are doing lots of stuff, either work, COVID, workmen in the house. So yeah, I've been given a pass to do something beautiful. Lots of people do strength work, lots of people do cardio, lots of people, even do a little bit of flexibility work. Mobility is equally as important, particularly for the joints. So just do what you feel comfortable. And 4. So again, you might not get the arm overhead, just go to where you feel comfortable. And then the circling action. And 3, 2. Let's do 2 more actually. And for 2, and for 1. Well done. And then keep the legs really, really wide. So again, all we're going to do is take the hips backwards. I don't want you to roll down. I just want you to just kind of take it straight back and just let the head just hang. So again, just rock a little bit. If you don't feel comfortable doing this, i.e. you feel like you're not really balanced and you can reach the floor, then take the hands down, and that just helps anchor you. And again, you may be alarmed at how tight your inner thighs and your hamstrings, the hamstrings are at the top of the back leg. The muscles there, they get silly tight. And then walk both hands to one foot or one shin. This is when you notice that your toenails are in a bit of a mess. And oh dear, I'm trying to be very good, and yeah, not indulge myself in things like pedicures and things, because I'm going skiing next week and it's costing a small fortune. So I think I'm going to have to get my own nail polish out. I did cut them last night though. And then back to centre, and then gently in. So again, once you get to kind of feet hip distance, soften through the knees, really soften, and gently up. If your back feels tight, it's always nice to have some softness in. So sometimes I'll have a straight leg, I'll take my hips back and I'll come down like that. I did quite a lot yesterday, I did hip, so I'm just having some nice softness, yeah? Takes it into the hamstrings, not the back. Hips backwards, weight forwards like you're falling over. And just gently. Let everything just hang. So because this is, I'm doing this in mind of some of my breast cancer ladies, I'm not going to do any inversions today, so I'm not walking it out into plank, into upward dog, into downward dog. You'll be glad to hear. One, because it requires quite a bit of strength that you might not feel like you've got, and two, I just want to keep off wrists, just in case there's anyone out there that has got, is at risk of lymphedema. I don't want to put too much pressure on the wrist. Okay, let's do a nice little, so this is where now, if we were doing one of my breast cancer rehab classes, we'd maybe do some weights now, but I'm not going to on this session, yeah, I'm just going to, I want to think more about mobilization and stretch. So let's take one arm out in front. If you feel balanced, you can do that, but this is just a bit of a hobby of mine, of doing this position, so feel free to just go into parallel, and just take that, and just push it in. Take a beautiful stretch. Don't close your eyes again, another hobby of mine, and it's, yeah, it can affect that balance. Maybe later down the line we can try that. And so this is stretching out, you probably can feel it, the big deltoid muscle, kind of here. This next one, we're going to, if you can, again, if you are struggling after surgery, this may not feel possible at all today, so don't worry, just go back into that deltoid stretch. Just realised I've got music on in the background. I hope this uploads. I'm just going to turn this off. Sometimes YouTube is very, very sensitive. I'll be really cross if this doesn't record. Yeah, let's go into the other direction. So again, out, just pull it in. And just notice, is there less tightness on that side? This one's not as tight for me because I lead a lot with my right and overuse it, and that's what you've got to be careful of after surgery. That you might, and it's understandable that you know, use the other side where you've not had your surgery, and it can get, sometimes you find that that actually ends up tighter than the surgical side. And then gently down, okay, and then just keep into this position. I'll come into it if you're not into it, and reach up if you can. If not, then just come over like this. Yeah, just push the hips out and notice how tight you may feel laterally through the side of the body. Take a beautiful breath in. Last one, breath in, and then gently up. You can do this next one if you want to work through the iliotibial band that can get tight. Soften the front knee, take the hips back, and just gently float down towards the floor. Letting the head just hang. I should call this part one and then do a part two to improve balance, guys, but there's quite a few of my videos on that go a little bit more intense. This one, like I say, is very much about mobilising and stretching and gently up. Gosh, my toenails really are horrible. And then the other side, and then again reach up, push out. A little trick actually, I do oncology massage, and unfortunately toenails, nails can be really affected with cancer treatments. So a really nice trick actually, if you do like your nails painted, they can be a little bit bumpy after treatment, is to use like a sparkly nail polish because it's got little bumps in. There you go. And then take the hips back, chin to chest and gently down. And just take a breath in and out. In and gently up. So I am literally going to show you 2 strength exercises now, just for those, you know, we need to, particularly if people are on a statin, well, not anybody really needs to keep their heart, you know, working as well. It's a muscle. So it might be the last thing in the world you feel like doing any strength work. You know, try and just maybe go around the block or something when you're feeling up to it. But these are just good, just to get that little bit of strength work going. So again, always find something to hold on to. These are rollers. Anyone who knows me know I use these a lot. But they are good for just holding on to as well. Yeah, if you're feeling a little bit unbalanced. Obviously it's not stable, so remember that as well. You might prefer to be at a wall or a chair. And all we're going to do is come up and lower. So draw that belly in. Obviously, if you don't need to hold, then don't. So I do a lot of these in class. You can do what we call Mockman Wise as well. Draw the belly in, ribs down. And this particular move, I'm not doing a very good impression of this one on my right side because I'm trying to avoid the roller. Always think of the wombles when it starts to wobble. 5, 4, 3, 2. You can probably really feel the calves. And 1. Well done. So that's all we're doing with calf raise. And we're going to just take that back leg and just take the heel to the floor. You should feel a nice calf stretch. Everyone should do calf stretches. Take it from someone. We all have different tightnesses, don't we? Some people suffer with lower back. I'm lucky not to do. Some people suffer a bit with neck. I do, neck and upper back. Some people suffer with tight hips. I don't. Mine's all kind of posterior. So since I started doing Pilates and I do a lot of yoga type downward dog work, I never get calf ache anymore. My Achilles are nice. They're not spongy and inflamed. I used to be like an old woman getting down here. Get downstairs, and don't be cheeky. I'm not an old woman, not just yet. No. Do you know, years ago I'd be well an old woman. It wasn't that middle age, something like 35. Anyway, quite a bit past that. And then just push down, hold. If Ruth's watching this, she'll be laughing at me. Something a bit weird, isn't it, about talking to yourself on it? I just can see all your pictures there. I can see my sister-in-law watching it. I can see my friends watching it. And then just come into a wide position. And again, keep the shoulders down, tight through the tongue. I quite miss lockdown when I used to be in here on my own, you know. And then just bring it back. So watch with the squat position. You're not doing that. You want to think about drawing the belly in. You can hold on to something and the bum comes back. The knees are in line with the ankle bone, not in the toes. Push back. Push back. Or you can change your arm position. Keep the core tight. Do you know, I bet I've been doing about 25 minutes already. And we've got 5 more. 5, 4, 3. We're not going to lunge because lunges are really tough if you've not been doing much for a while. And 1. That's it. Well done. And then just again another little and circle back. And back. Well done. Okay, excellent. Let's come down onto the floor. I'm just going to check the time, guys, on here. Yeah, 25 minutes. Oh, I feel great. Okay, I don't get to do just really gentle classes that often. So come down onto the floor and I'm just going to show you again a little bit of movement for the back. So there is sometimes when you go into early menopause, there's a little bit of potential risk of osteoporosis and the older we're getting. So coming up into full bridge isn't always the best thing to do. I love bridge, I think it's beautiful, but if you have got osteoporosis, just come up onto the bottom rib. So I'll just show you. So with the bridge position, you want to just walk the feet a little bit closer to your bum. Try not to let the knees flail out to the side, so you want the knees parallel in line with the hip bone. And the most important thing, and after surgery this can happen, we want to try and really lengthen through the front of the collarbones. Walk the fingers down and just watch if you're not used to bridge. So I'm in what we call neutral spine, pubic bone, hip bones, belly button. Yeah, they're all level. Yeah, so the belly button isn't higher than the pubic bone, and by that I mean if you had a tray of drinks on the tummy, you wouldn't be spilling them down to the floor, because that happens, it's horrible, particularly if you're doing abdominal work. Likewise, if you spill the drinks into your belly button and you tuck the lower back into the mat, yeah, that's not where you want to really do abdominal work neither. You want to do it in what we call neutral spine. Ribs are in and down on the mat, really important, and a little gap underneath the lumbar spine. We're not doing any abdominal work today, just the tiniest little bit, but what we are going to do is bridge. So we're in neutral spine, the tray of drinks are completely level. We're going to take a breath in through the nose, and we're going to gently roll that lower back into the mat, and I just want you to lift your bum. And then lower back down through imprint, back to neutral. This is a way of just firing up the core. So again, roll the lower back, and at the same time take the navel in towards the spine. Nice flat tummy. Lift the bum and exhale back. Let the tummy rest a little bit. Inhale, draw the belly in, lower back to the mat, lift the bum. Hold and let back down. It's a nice way just to get that core connection. If you are used to bridge, you can take a breath in, roll the lower back into the mat, and just start exhaling as we come up into our bridge position, sending the knees nice and long, the hips are high. You're not up here, you are on the shoulder blades, the ribs are down. You've got what we call like a ski slope. Yeah? Hey! Hopefully I'll see one of those next week. Currently, one of my sons has got COVID, so I'm trying not to get too excited. And then gently restack the spine back down, bone by bone, all the way through imprint. You may have tried that and you may have felt too much, yeah? If you're lacking a bit of strength because you've been having surgery and you've just been fatigued, totally understandable. You might not get up into bridge, that might be enough. Just drop in, yeah, so into imprint, lift the bum, gently back down. We'll just do 2 more bridges for those of you that love bridge. Take a breath in, gently roll the lower back into the mat, start lifting your bottom, lifting your lower back, your mid back, sending the knees nice and long. Take a breath in and slowly down towards the floor, bone by bone. Beautiful. Take a breath in through the nose, gently back again, lower back into the mat and start lifting. Sending the knees nice and long. Anyone out there that is maybe found my video? I'm not great with other than people that I know giving my video on YouTube. I don't really know how to do search engines and stuff. But if there's anyone that is fallen on it and you really want to do some breast cancer rehab work, then please just try and send me a message. My email is pilatesjoe67@gmail.com, and I do Zoom classes on a Wednesday lunch and Thursday lunch as well. You'd be more than welcome to join. Okay, so now we're going to take the legs together. We're going to take the arms out to a capital T. Try and be in neutral spine, and just to release the back, Take the knees in one direction and the head to the other. And we're going to relax the belly because we want to stretch the back out. So inhale, let the belly rise. Exhale, draw the belly in. Back to centre. And the other direction. Inhale, let the belly rise. Exhale, draw the tummy in. Back to centre. Really important to stretch the back out. Not just if you've been doing lots of strength work, which obviously you need to do if you have been, but just for comfort, gently down. We've got a lot of nociceptors, pain signals in our lower back, and generally when we get run down, it's our body's way when we get a bit of pain to just say relax. Draw the tummy in, use the abdominals to come back to centre. So one more in each direction. Take the knees in one direction, inhale, let the belly rise. Exhale, draw the belly in, back to centre. So today at 1 o'clock I've got a Zoom, a breast cancer rehab. I'll record that and I'll put it on YouTube. And then if you find this one beneficial but you want a little bit more, then you'll see how the class will progress. Okay guys, lovely. Just take the soles of the feet together and just walk your hands down and just lie in that butterfly position. Again, just you can take some lovely deep breaths in through the nose, out through the mouth, in through the nose, out through the mouth. The last one. Well done. And then just come back to centre, and we're just going to do about another 5 minutes or so. So I just want you to be in neutral spine. Again, think about that tray of drinks. You don't want to spill them forward, you don't want to spill them back. And all we're going to do, it's harder than it looks this, we're going to draw the belly in, ribcage down, and I want you to try and lift one leg. And keep that neutral and lower it back. Yeah, so we're not going like this, moving the pelvis, we're doing it very, very carefully. Keep the core tight, draw the belly in, lift one leg up, keep the ribs down, lower back. And again, the other side, push that foot in, lift, and lower. And again, make sure you breathe in, make sure you're not lifted. Remember the pelvic clock, yeah? So we don't want to rock into 6 and 12, and we don't want to rock side to side as we lift the legs. So everything's very still. Place your hands on your hips. 1, lower down. Try not to let the belly come big. And again. And again. And obviously the stronger you get. Sometimes it's so lovely for me to go back to basics and realise actually how much recruitment you have to use. And then once you get bigger, stronger, you can then obviously start doing double leg work, making sure that's not happening. But we won't do that today because it's nice relaxation. Okay, beautiful. And then I just want you to cross your ankles and bring your knees into chest. And again, just notice if there's any tension in the lower back. Now we're just going to go very much into our shoulder mobilization. And then just gently down. Another nice one for the core is just kind of letting the legs, so drawing the belly in, pushing the ribs down, letting the leg fall out to the side without dropping. Yeah, so you just kind of go like that. And bring it back in. And again. And back in. Okay, beautiful. I just want to do one that just for the ankle area as well. So if you just bring one leg up and then just circle through. Again, any circling action is really good for joints. and then the other way. And the chemoreceptors, our movement patterns, live in our joints. And it's firing up to our brain going, yay, we're mobile. Yeah, and then gently down, and then again, draw the belly in, lift up, circle. Mind click a little bit. Circle back. You can do this sat on the settee. Yeah. And then gently down. So a bit like the hip ones we did. And then I just want you to lie down, and I'll just talk briefly. You like briefly? You never shut up. Okay. Just lengthen through the front of the chest, and your shoulder blades are down on the mat. Ribs are down. Little gap underneath the lumbar spine. The important thing is that your ribs are in and together. They're not coming up and away, because that happens with the back. So your posture, ideal posture, and no one's really got perfect posture. Little chin towards the chest, so you don't want to be seeing the back of the room. Yes, sometimes you may need a little bit of a cushion underneath the head to allow that to happen. Walk the hands down so the shoulder blades are firmly on the mat, and then take your hands on your ribs and do a big cough. So when you breathe in, bring the ribs up and away, so the part. Think about if you've been pregnant when you get that separation, and then exhale and push the ribs in and down, and that's where you want them to be. And then little gap underneath the lumbar spine, bum on the mat, and if you were doing any abdominal work in this position, like hands behind the head, a nice one to do is this, just for that lymphatic system, is just chin towards the chest, and you can just lift up. The ribs are down, but you've got that little gap, so you're working into neutral spine and gently down. Yeah, so that's the optimum position. But we are just going to relax now. So just gently. So if you're doing a relaxation pose, you don't have to worry about that tightness in the tummy. You can just lay your hands on your belly, good for lymphatic system, and you can just take a big belly breath and let the belly rise up into the hands. Just notice why we don't let the belly rise and relax when we're doing abdominal work, because it takes the back away. Exhale, where it's nice just for relaxation. And again, 3 more. Two more. Last one. Well done, and then just bend the knees, just take a little sideways again. And then we're just going to do a few minutes of our shoulder work. So I just want you to just either lie like this or a nice straight leg. And I just want you to do what we did stood up. So take one arm up towards the ceiling, and then imagine springs coming. Is it spring when apples bloom? I can't remember, not bloom. Grow. Just pick an imaginary apple off of a tree and retract. So protract and retract. Protract and retract. Protract, retract. Take it down the other side. Protract, retract. Protract, retract. Protract, retract. And again. Good. And then all I want you to do is palms down. So again, a bit like we did earlier. Take the palms up. You might find it's a bit sticky there. If you can push it a little bit, do. Obviously not into pain. Palms up and then overhead. You might not get anywhere near here at first. Don't worry. Just go to where you feel comfortable. The hands may feel like they're raising. Again, that's fine too. Yeah. Palms up. And one more. And take both hands up together. Keep the scapula down. Take the palms together. And then gently, again, you might only get to there. Try and keep the ribs down. Just go to where you feel comfortable. Sometimes it's nice to have like a cane, some kind of cane, and again, push it. How far can you get? One arm might be way here, yeah? If you've had surgery on one side, initially that will be difficult. So do that a few times, yeah, daily, see where we can improve that range. If you were starting to lift weights into flexion, you want to get your full range of motion back before you start lifting. Push the rib cage down, palms facing each other, and just go into scissor again. Go easy. You might not get to the floor. We often do this on the roller, my favourite exercise, but it's always important that you just start on the floor and then just go to where you feel comfortable. Sometimes holding a small, very small hand weight, like a 0.5 kilo, can help. The next one, watch me first, because some people struggle with this. Angel arms, so the hand that's near the thigh starts doing a semicircle up to the head. The hand that's at the head starts doing a semicircle down to the thigh. And then you always come back up to me. Some people, I like to alternate direction. Some people get this straight away, some people it takes a long time. So just go easy. Usually that abduction is the little bit tender area. So anything that doesn't feel right, don't do it. Yeah, keep coming back to it on another day. And again. But most people love this. For 3. 2. Notice that my ribs are down, they're not coming up and away. My back's keeping in alignment. Last one. When your body moves easier, yeah, so sometimes I love strength work. Like I've said, I love HIIT, but I would get injured if I didn't do things like this, so they're equally as important. And sometimes when your body is not too tight and moves well, you will get better results as well. So that is it. I was going to turn you over to show you a little bit of side leg, which is in the breast cancer book. Yeah, where you kind of make a pillow like this. We do some open door work. And we do some stuff like this, where you lift at the bottom waist. But I'm not, because I think if you're just new to exercising, 40 minutes is probably enough. So just stay down on the floor. I'll come and turn my camera off, and if you've enjoyed it, please subscribe. And more important than that, drop me a message if you've got any questions. All right, take care. 42 minutes, I love that. Ciao.